A 3-year-old child with fetal alcohol syndrome is seen in the pediatric clinic today for a well check, immunizations, and developmental screening. She is known to be behind in developmental milestones for her age and has some learning disabilities. The adoptive parents have accompanied the child for the well visit.
Hello, how are you doing today? Good, how are you? Good. I'm pretty good. I'm an RN. I'm Mrs. Malibu. Where are you here for today?
I think I've been throwing up nonstop.
The flu? Okay. For how long? Are you looking?
Well, since Sunday morning.
Sunday morning? Okay. Here, I'm gonna do this, little paper about alcohol. Do you drink? Now, for one, how often do you have a drink containing alcohol? Okay, and then how many drinks containing alcohol do you have on a typical day when you're drinking?
12 times, give or take.
Okay. How often do you have 6 or more drinks on one occasion?
Every day.
Every day? Usually every day? Okay. How often during the last year have you found that you weren't able to stop drinking once you started?
Every day.
Every day? Okay. How often during the last year have you failed to do what was normally expected you from because of your drinking?
Well, I still function.
You still function? Okay.
Functioning.
How often during the last year have you needed a first drink in the morning to get yourself going after a heavy drinking session?
Best way to cure a hangover is start drinking.
Okay. And then how often during the last year have you had a feeling of guilt or remorse after drinking?
Not very often.
Not very often, but every once in a while?
Yeah, when I drink Crown.
Okay. How often during the last year have you been able to remember what happened the night before because you have been drinking?
I have good recall of what happened the night before. I usually don't black out.
Okay. And then have you or someone else been injured as a result of your drinking? No? And then has a relative, a friend, or a doctor or other health worker, have they been concerned about your drinking or suggested how you can go down?
My mom is a little bit concerned, but I don't talk to her very often.
Okay.
That's probably the reason behind me not talking to her.
Okay. And then how many sexual partners have you had in the last year, would you say?
Probably above 20.
Okay. I do think that it might be a good idea to take a pregnancy test. Do you think you'd be able to go for me?
Yeah.
Okay. We're gonna do that next time. Hello, Dr. Crown. I have a patient here, Stephanie Schnapps. She came into the ER with a side of the window. She didn't smell alcohol, so I was thinking maybe we could do some type of testing for her, ask her a few questions. And she stated about multiple sexual partners, so maybe a pregnancy test would be a good idea to find out how she's feeling.
Absolutely. I'll go ahead. I'll put the order in for a pregnancy test when I get the sample for that.
Okay? Okay. Thank you. Let me go turn off. Let me get a cup for you. And now it does come out positive. We can talk about options for you. We can see how far along you might be. And any questions that you have you can ask me too, okay? Okay, perfect. That should be enough. Okay. I'll be right back, okay? You can sit back down and we'll be back. Okay. For Brittany Schnapps, her test did come back positive for the pregnancy test. She told me around 20 in the past year. Okay. Perfect. I'll let her know you're coming in. All right, maybe.
Dr. Crown, physician's call on line 1. Dr. Crown. The CDC reports 1 in 10 American women drink while pregnant. Consuming alcohol while pregnant can lead to abnormal facial features, small head size, shorter than average height, low body weight, hyperactivity, difficulty with attention, poor reasoning and judgment skills, poor memory, difficulty in school, learning disabilities, speech and language delays, intellectual disability or low IQ, vision or hearing problems, problems with the heart, kidney, or bones, and fetal syndrome. Think before you drink.
Hello, I'm Dr. McCarty.
Hi, Dr. McCurry.
All right, and this is our 6-month checkup.
Yes, we'll check on here.
Awesome. How's she doing at home recently?
She hasn't really been sleeping well. She wakes up usually really irritable, and nothing we do really.
And you know, when we adopted her, all we learned was that she had a low birth weight, and a couple other things. So we're really concerned too with her eating because she's not really sucking very well with the formula. So we're not sure if she's eating enough or what we should be doing to help
Okay.
her along.
Well, as you know, when she was born, she also had a small head circumference size, and she also has that between the nose and the upper lip. These are all common signs and symptoms of fetal alcohol syndrome. So this is something that will be a lifelong process that we have to work through. She also had this heart murmur, but it resolved itself, and that's very common of babies that have fetal alcohol syndrome. And low birth weight is normal, poor sucking is normal. It's just we'll have to try to feed her a little bit more often. Irritability, is she sensitive to light at all?
Very sensitive.
Okay. They also have a little bit of slow development, so it might take her a little bit longer to grow.
Okay, so we should
Okay.
expect.
Yeah.
So we should expect a smaller size. Okay.
Yes.
Okay.
People with fetal alcohol syndrome also have a lot of vision problems, so it's really important that you go see an eye doctor and get checkups starting now at 6 months of age, and then ask the eye doctor how often they should check up with you.
Okay, that's good.
Her vaccinations today, she's going to get a Hep B vaccination, rotavirus, which is for the stomach, and DTaP, the HIB, polio, and influenza. She's going to get a few vaccinations today. Okay. And then when you come back at 12
Vaccination, 6 months, Hep B, rotavirus, DTaP, Hib, polio, and possibly influenza. 12 months, varicella, Hib, and MMR. 15-month DTaP. Discriminating features: short palpable fissures, flat midface, short nose, distinct frenulum, thin upper lip, microanthia, minor ear abnormalities, Lowe's nasal bridge, epicanthial fold. Normal brain versus a fetal alcohol syndrome brain. Something to think about if drinking while pregnant. Fetal alcohol syndrome is 100% preventable.
Hello, I need Jacqueline Daniels. Ready for your checkup. Okay, I'm just gonna get some vitals for her, blood pressure.
Okay.
And her temperature, just for like a baseline.
Okay, sounds good. I don't need that. Yeah, she's gonna check her stuff with this. I don't need it. You don't need it? No, I'm not need it. Because she needs it.
I need it for
It's gonna be okay. It won't hurt you.
It's gonna be like a hug on your arm.
Look, it's fun. You wanna see mommy do it? Look.
individualized education program describes the educational program that has been designed to meet that child's unique needs. Each child who receives special education and related services must have an IEP. Each IEP must be designed for one student and must be truly individualized document. The IEP creates an opportunity for teachers, parents, school administrators, related personnel, services, and students, when age appropriate, to work together to improve educational results for children with disabilities. The IEP is the cornerstone of quality education for a child with disability.
So, as a toddler, which she is right now, she can have poor memory and hyperactivity. I'm sure you've seen her at home. She's probably always going.
Yes. Yes, she is.
Yeah. She probably has no sense of boundaries, a lack of fear. She's just doing all this stuff at home. Yeah. And a need for physical contact. Does she have that too?
Yeah, she's always hanging on one of us.
Crazy. When she gets into grade school, she's going to have a short attention span, maybe poor coordination with difficulty in fine or gross motor skills. So it's good that you still have her in therapy and you're keeping her in it to help with those motor skills that she has.
Yeah, I think her motor skills are definitely have improved.
Yeah, they
Definitely.
have.
They looked really good when we
Okay.
did the assessment earlier. So the therapy's definitely helping.
That's good.
When she gets a little bit older, they can have still the same trouble with school and they can develop low self-esteem. So it's best to keep her self-esteem up, encourage her with all the schoolwork, have her, if she has some friends, have her hang out with those friends, stuff like that. As you know, as we discussed, when she was 6 months old, to keep a routine at home as best as you can, and to learn when she's getting frustrated. So make sure she understands the rules at home, and that you're keeping those rules all the time, and you're letting her know when she is having good or bad behavior, so she can help fix this behavior if she's having any bad behavior at home. Teaching self-talk is really important. Have her use short phrases as stop and think, so she can learn how to do things on her own and to have good behavior.
Okay.
It's perfectly normal if you have to repeat things a bunch of times for her to understand and to do what you ask, so you just have to be patient with that and get directions one step at a time.
Okay.
Wait till she does that first step before you move on to the next one, and then when she gets a little older, she may not want to be as physically to have as much physical contact as she has right now. So you'll just have to tell her before you touch her.
Okay.
And you just have to be firm and consistent, keep those rules going. Keep the rules so she understands them and progresses.
Okay. That's what I was hoping to get back.
Yeah.
Maintain the rules. We like to bend them.
As they get older, children that are adults that have fetal alcohol syndrome, they can have mental health problems when they get older, or they can get in trouble. That's why it's really important to keep those rules at home.
Okay.
Also, they can have an inability to live independently, so you have to be prepared for that in case that happens. So there are some cases where they cannot live by themselves, so there are some that they do live by themselves and some that they don't. We'll have to see how she progresses and
Okay. We do try to encourage her independence and self-play and things like that. So
that's great. Do you have any more questions?
no, I think we're good. Yeah. Thank you so much. We'll schedule our next appointment with the receptionist.
Perfect.
Thank you.
Thank you.
A client is Gravida 2, Para 1, and is currently 12 weeks gestation. She states that she drank beer throughout her last pregnancy. The client asked the nurse if it is okay to have a few drinks during this current pregnancy. Which of the following responses by the nurse would be most appropriate? A. It is safer to consume wine than beer during pregnancy. B. It is not safe to consume alcohol in the second and third trimesters, but the first is safe if consumed in moderation. C. It is not considered safe to consume alcohol during pregnancy. D. It is safe to consume 5 ounces or less of alcohol per week in the first trimester. correct response is C. Complete abstinence from alcohol use during pregnancy is recommended. A safe level of alcohol consumption during pregnancy has not yet been established. Conclusive evidence surrounding the effects of either social or moderate drinking on the fetus, regardless of trimester or gestation, are not available. The best answer is to advise the pregnant woman to abstain from all alcohol usage. A woman with a history of chronic alcohol abuse is admitted to the obstetric unit in labor. When assessing the newborn, which of these findings would be consistent with a diagnosis of fetal alcohol syndrome? Select all that apply. A. Small palpable fissures. B. Excessive nupal skin. C. Small jaw. D. Hyperflexibility of joints. E. Low set and small ears. F. Thin upper lip. Correct answers A, C, and F. Ethanol freely crosses the placenta and can interfere with the embryonic and fetal development. Many of the most noticeable effects of fetal alcohol syndrome are craniofacial abnormalities. Some of the cranial characteristics of fetal alcohol syndrome include small palpable fissures, thin upper lip, a thin vermilion border, and small jaw, microranthia. Infant is born to an alcoholic mother. Which assessment finding would the nurse anticipate that would contribute to the findings of fetal alcohol syndrome? A. Lethargy. B. Irritability. C. Blindness. D. Unresponsiveness. Correct response B. Fetal alcohol syndrome is congenital abnormality resulting from excessive maternal alcohol intake during pregnancy. It is characterized by typical craniofacial and limb defects, cardiovascular defects, intrauterine growth restriction, and developmental delays. Newborns with FAS are very irritable and difficult to calm and comfort. Seizure activity may also occur. Other options A, C, and D are not associated with fetal alcohol syndrome. Caring for a mother who has abused or is abusing alcohol, and for her infant, nurses should be aware that A. The pattern of growth restriction of the fetus begun in prenatal life is halted after birth and normal growth takes over. B. 2/3 of newborns with fetal alcohol syndrome are boys. C. Alcohol-related neurodevelopmental disorders are not sufficient to meet FAS criteria and are often not detected until the child goes to school. D. Both the distinguished facial features of the FAS infant and the diminished mental capabilities tend toward normal over time. Correct response C. Some learning problems do not become evident until the child is in school. The pattern of growth restriction persists after birth. 2/3 of newborns with FAS are girls. Although the distinctive facial features of FAS infant tend to become less evident, the mental capacities never become normal. The symptoms of FAS can't be cured, but early diagnosis and treatment can improve a child's development and outlook. Research shows that children do better when select all that apply. A. Are diagnosed before age 6. B. Are given large doses of sedating medications. C. Are in a loving, nurturing, and stable home during their school years. D. Are not exposed to violence. E. Avoid all sexual contact when they are older. F. Get special education and social services. Correct response A, C, and D. Early intervention services may help reduce some of the effects of fetal alcohol syndrome and may prevent some secondary disabilities. Therapy can help with behavior and educational problems. Parents can also get training to help their child. Medicines can help manage symptoms like hyperactivity, inability to focus, or anxiety, but they do not use large doses to sedate. A child with fetal alcohol syndrome needs to be watched closely to see if their treatment needs to be adjusted. Avoiding sexual contact when they are older is not part of how they will do well as a child. Sexual contact should be discussed at an appropriate age, as they may only feel comfortable with someone who is developmentally the same age as them, which would be inappropriate.
Then how about these are weird questions. Okay. I'm sorry. She's talking to me.
Taping me?
Mama needs her juice.
Mom needs a juice.
Alright. How do I explain?
Also need to.
Is this a 6-month checkup? Yes, it is.
For Ella.
It's not your real
It's not real. No, we're just playing pretend. Bring it all full circle.
We always do cute.
You don't want to help
Wait, is red blinking? Red still filming? Oh.